Most people go through times of emotional crisis and stress. It's estimated that 1 in 4 people use mental health services during their lifetime. Many people are unaware that they have a right to use the services provided by the council and health authority. Mental distress includes a wide range of symptoms, and people caring for an elderly relative may not immediately realise that there is a problem.
All she did was sleep. Tried to wake her up. She used to burn the saucepan where the tea was. And I thought, when I have to scrape it, I say, Mum, it's your job to scrape it off. I'm not going to do it anymore. She said, leave it. I'll use another one, she says. But she didn't know she'd done it. That's when we were worried that she used to forget. And you can't see your parent like that.
I was by myself, looking after him. He used to stand at the sink all the time, washing his hands and face, saying he was dirty. Then I got ill. My arm started to ache from steering him away. Things are getting better now.
Dr. Malik is a consultant who specialises in mental health.
In old age, when people start to get depressed, it'll usually manifest as them withdrawing from the normal commitments, their normal responsibilities and engagements. People who are suffering from dementia and the various varieties of it, which in terms of actual problem means that the cells of the brain start to not function as they normally should and then start to perhaps die off. As the illness sort of develops and goes on, the memory impairment becomes more severe to the point that they would start to forget things that they'd done just half an hour or 15 minutes before. And they would be asking for things to be repeated. And this sort of gradually goes on until they become very forgetful. And the ultimate sign would be that they won't even, they'll have difficulty recognizing the very near ones whom they've lived for years.
It may be difficult for carers to distinguish some of the symptoms from the normal process of ageing, but it is important to get help early. Research suggests that Asian communities tend to be less likely to take up the services on offer than the rest of the population.
If you're looking at the mental health side of things, within our team, community mental health team, we didn't have any Asian workers. And I think if you look across the border with social services, we don't really have many Asian workers. And a lot of people tend to, because of the language barrier, they feel that if they do approach any of the teams and there's a white worker or something and there's a language problem, they're not really going to understand where the person's coming from. And so I think that was one of the reasons why people didn't used to come in the past. But now I think we've got more, Asian workers, and people are beginning to come forward.
I think there is this major issue of prejudice against, mental health and the stigma that is attached. That is very much prevalent in the local population. I think it's much more with the Asian population. They still don't want to see mental health problem as a problem. They will still attribute that to other issues like a spell being used on the person, and as a result of that he's not functioning as normally as he or she does.
Once you have established that there is a problem, there are several ways to ask for help. You can talk to your general practitioner. You can contact the community mental health team for older people. Or you can speak to a specialist voluntary organisation.
You could contact the Sahara project and we'd arrange an appointment with you and come out to visit you, assess the situation, see what the problems are. If it's requiring support in terms of different groups, then we'll help in terms of accessing those groups. But if there's more input required, then we would contact the community mental health team.
Community mental health team operates on an open referral system, which means that anyone can call us directly and they can ask to speak to someone in their own language, or they can go through the GP. They will do the initial assessment.
A visit can be arranged in the privacy of your own home. During the home visit, you'll have the chance to say what your needs are and will be told about the range of services available.
The
day centre people did approach us from 2 or 3 different places, but my mother wasn't very happy about attending, so I said no. But when my wife wasn't very well, I did approach the social services. They told us we were entitled to 5 or 6 weeks break. And they put her in a nursing home and paid some of the costs.
ਜਿਹੜੇ ਜਿਹਨਾਂ ਦੁੱਖ ਹੈਗੇ ਆ ਤੇ ਫਿਰ ਮੈਂ ਗਈ ਤਾਂ ਇਹਦਾ ਸਧਾਰਨ ਗੱਲਾਂ ਉੱਥੇ ਹੋਈਆਂ ਵੀ ਜਿਹਨੂੰ ਤਕਲੀਫ ਆ ਉਹ ਦੱਸ ਦੇਵੇ.
He couldn't wash or bathe himself, and there was nobody to take him out.
ਬਹੁਤ ਵੀ ਨਹਾ ਨਹੀਂ ਸਕਦੇ, ਬਾਅਦ ਵਿੱਚੋਂ ਕੱਢੇ ਕੋਣ, ਮੈਂ ਤਾਂ ਇਸ ਤਰ੍ਹਾਂ ਕੱਢਾ ਨਿਕਲ ਨਹੀਂ ਹੁੰਦਾ ਸੀ. ਫਿਰ ਸਾਡੇ ਘਰ ਦੇਖਣ
Social services came to the house to have a look, and we asked them for a wheelchair.
ਤੁਸੀਂ ਉਹਨਾਂ ਭੈਣ ਜੀਆਂ ਨੂੰ ਕਹੋ.
They told us to contact the women at the community mental health team, who in turn sorted the chair out for us.
ਫਿਰ ਉਹ ਚੌਂਕੀ ਦੇ ਗਈ ਉਹ ਗੋਰੀ ਆ ਕੇ.
After your assessment, a care plan is drawn up, which says how your needs will be met.
After I've done the home visit and we've identified the client's needs, so we tend to write all the client's needs in a care plan. And if the person needs Meals on Wheels or something like that, I would try to arrange that. And if the person is living on their own and they're feeling isolated, or they may be living with a family and they need a bit of a break from one another, then we would look into daycare. And daycare is a short-term thing. Somebody can go in the morning, come back in the evening. But if a family felt they wanted to have a couple of weeks off, maybe to go to India, while they go on holidays, their mother or father is being well looked after. That sort of care is provided in a residential home. Again, on the care plan, we would write it down the person's needs, such as vegetarian food, perhaps, or maybe religious needs, so that would be taken into consideration.
ਉਹਨਾਂ ਨੂੰ ਹੈਲਪ ਦੀ ਤਾਂ ਸਾਰੀ ਦੀ ਜ਼ਰੂਰਤ ਸੀਗੀ ਉਸ ਟਾਈਮ ਤੇ. ਉਹਨਾਂ ਨੇ ਜਿਹੜਾ ਵੀ
At that time, she needed a lot of help, things to eat, a proper bathroom. We applied to the council, and they put us in touch with the social services, and then we applied to them. And after that, they built a bathroom and a bedroom for her. Social services helped by applying for a grant for the bedroom and the bathroom. They made sure that the council approved the facilities.
Oh, she goes to Gospel Centre, and at the first she didn't want to go. She said, "What I do there? Sit down, I come back." But I went with her a couple of times. I used to see her do exercise, and used to watch a film, and they used to do things that was really nice. And the first few months she didn't want to do it, so we all encouraged her, and we say, "Look, if you do it, we can do it with you." And she thought it was funny.
The Gosford Asian Day Centre provides group work, exercise group work, gardening. They have their own shower facilities, disabled toilet access, catering facilities. They have an Asian cook. All their staff are Asian and speak various Asian languages. The aims of the Reminiscence Group are to ultimately improve the quality of life for Asian elders. It's to improve their long-term memory as well as short-term, and it's also for Asian elders to talk freely about experiences that they have through settlement into Britain, the isolation that they may have experienced, and also the anxieties of breakups of family support networks and how they can share those experiences in a friendly environment.
St Paul's Centre provides daycare for families, as well as women-only activities and meetings. If you find it difficult to travel to services, transport can be arranged. For day centres, an escort service is available. There is also a ring and ride scheme, which can be used by elderly disabled people who want to travel independently. Caring for someone with a mental health problem can be a heavy burden, and it is important to look at your own needs as well as your relatives. Some services have been set up specifically to help carers.
Asian Care Support Group meets once a month. It enables other carers to meet and share their experiences. Caring can be a very demanding job and very stressful. Carers are vulnerable to stress, and they need to recognize their own needs for support and accept help.
If there was someone to take him out and go for walks and just chat, maybe he could get better.
Stress on the carers would be much less if problems are tackled right at the start rather than further down the line. And various studies have shown that the mental health problem in carers as a reaction to the stress that's put on are quite significant.
The Carers Support Group exists not only to support each other, but also to lobby for better services for Asian elders in the city.
We know she's getting old. She can't get back normal like it used to be, but that she is better than before, a lot better.
Most of the time, at the moment, we tend to get referrals at a crisis point. At that time, it sometimes involves taking a person into hospital, or we are not able to support them appropriately. But I think if people started coming forward at the early stages, we may be able to sort of prevent a lot of situation going into crisis.
She had a bath. She come down. She doing pray. Then I'm really, really pleased. Then when she finished, I hug her. Then I'm really, really pleased. Then tears come through my eyes. I couldn't believe she's got back normal. Then she shout. She used to shout at us. Then I'm really, really pleased.
I used to go to the hospital and massage him using oils, hoping that somehow he would get better. We're doing everything we can for him. He used to be a doctor in India, you know. He himself has treated thousands of people.
Anyone can suffer from a mental health problem. At times it can be difficult to ask for help, but local services have been set up to meet your needs. If at times you feel unable to cope, it is important for you to take up these services and recognise that they are your right. If you think you need support for yourself or for an elderly relative, contact either your general practitioner, the Sahara project, or the community mental health team.